My fellow Idahoans, I want to take the opportunity to thank you for protecting your loved ones and our neighbors from COVID-19. Case counts and hospitalizations were rising rapidly in November, but collectively, once again, we came together to do the right thing. And virus activity and its impacts have been trending downward in Idaho throughout the months of December and January. When I put in place the Stage 2 statewide public health order in November, case counts were spiking and hospitals were bracing for the worst. Today, thanks to you, those case numbers are much lower and trending downward. Idaho is now has one of the lowest case rates of spread in the nation. In November, our daily hospital admissions were approaching alarming levels, and hospitals across the state were experiencing severe constraints. Today, Idaho hospitals are still stressed for resources, but the majority are operating much more normally, thanks to the decline in COVID spread, again, thanks to you. Those collective efforts have put us in a position now where we can move out of Stage 2 of our Rebounds plan and forward into Stage 3. That means Idaho remains open, but with some necessary limitations. The gathering size limitation will increase from 10 to 50 people. This does not apply to political and religious expression, educational activities, and healthcare related events such as COVID-19 testing or vaccination events. It also does not apply to youth sporting events as long as organizers comply with spectator plans administered by the Idaho State Board of Education. Bars and restaurants and nightclubs should continue to operate with seating only. Masks are still required for long-term care facilities. Everyone, including businesses, should follow physical distancing and sanitation recommendations. Large events, such as trade shows, weddings, and sporting venues with more than 50 people may receive an exemption if the organizer confirms with the local public health district that the event will follow necessary physical distancing and hygiene protocols. However, this is not a signal to let up on our collective good efforts. We must stay vigilant. Idaho is surrounded by states that have detected a much more contagious variant strain of COVID-19. We know it is only a matter of time before we discover it right here in Idaho. Early indications are that the COVID-19 vaccines will protect you against the variant strains circulating in the United States now, highlighting the need for Idahoans to choose to get vaccinated to protect lives, our healthcare system, and our economy. Dr. Christine Hahn, our state epidemiologist, will explain in greater detail our progress and why the metrics which have guided every step of the way now indicate a return to Stage 3 is appropriate. Dr. Hahn.
Thank you, Governor. The data is really pleasing to us. We have seen a dramatic drop in cases in the state. We indicated on the chart that back when the governor last evaluated situation at the end of December, we still had a lot of cases every day, and those continue to drop dramatically. So we've been very pleased with that. Next slide, please. In addition, at that point in late December, we were 23rd in the nation as far as our rate of cases, and we have dropped down to 40th. Again, not where we need to be. We need to keep seeing those numbers go down, but that was also very welcome news. And again, as the governor's emphasized, I think that the fact that Idahoans have stepped up, I'm really impressed when I go out and about, need to get to the grocery store, whatever. People are wearing their masks, people are social distancing. I think people are really trying, and I think it's paying off. Next slide. And then lastly, and most significantly, as far as the actions today, we are seeing the number of people that need admission to the hospital dropping. And you can see compared to late December how indeed we still continue to see people admitted. We're not out of the woods, but we have seen quite a decline since then. Next slide. However, as the governor already mentioned, we are concerned. This is not the time to throw the masks away and go back to normal. We're not there yet. As the governor mentioned, we are concerned that, first of all, vaccination efforts are really still in the beginning stages. We were very pleased this week that many seniors were able to access vaccinations, and that will hopefully continue to ramp up. But we know that many people have not yet had the opportunity to be vaccinated. And in addition, as this graph from CDC shows, or this map shows, several of our neighboring states, in fact, most of them, have already detected the variant strain. We have not, the first variant strain, the B.1.1.7, which was first detected in the United Kingdom. So we know that it is probably here. We haven't detected it yet. We do remain vigilant where our labs are looking for this strain, but we should behave as if it's here or it's on its way, continue to be vigilant, while we also hope to move forward with decreasing some of the restrictions that we've had in place before. Thank you.
Thank you, Dr. Hahn, and thanks to all our public health people in Idaho. My fellow Idahoans, we have learned a lot about COVID-19 over the past year, but one thing remains constant. The more people you interact with, the longer the interaction lasts without wearing masks, the higher your potential risk of becoming infected with COVID-19 and potentially spreading it to your loved ones. That spread has damaging impacts on our lives, our healthcare system, our schools, and our economy. Idaho has the strongest economy in the nation and the most financially solvent state budget. Let's keep it that way. So please, continue to choose to wear masks. Continue to keep a safe distance from others. Continue to get tested as needed and stay home if you're sick or if you've been directly exposed to COVID-19. Choose to get the COVID-19 vaccine. We are doing a good job, Idaho. Let's keep it up. Thank you.